who says failing statistics means the end of your psychology career? Melissa Freeston's path from academic setback to leading social reform proves that sometimes your greatest challenges become an invaluable part of your story. Professionally Psyched is the podcast that brings you cutting-edge psychology research and real-world insights from our psych community of clinicians, researchers, and educators alike. In our special alumni spotlights, we chat to graduates from our psychology degree programs about how their skills learned in the classroom have become powerful tools supporting diverse career journeys and successes. Hi everyone and welcome to Professionally Psyched. I'm Jessica Muller, PhD candidate in Public Health at James Cook University, and before we get started we'd like to acknowledge the custodians of the land on which we record, and for me today that's the Bindal and Wulgurukaba peoples. And I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples and cultures from wherever you may be tuning in from across the country. In this alumni spotlight, join Dr. Amanda Krause as she chats with Melissa Freeston, whose journey spans leadership roles and national suicide prevention programs before returning to private practice and PhD research on birth trauma. So grab your headphones and get ready to get professionally psyched about turning degree setbacks into stepping stones for building a meaningful career. Enjoy.
Melissa, thank you so much for joining me on the podcast today. Could you introduce yourself, please?
Yeah, sure. And thank you so much for having me. So my name is Melissa Freeston, and I'm a psychologist in Townsville.
And I know that you are currently doing a PhD through JCU as well, but I wondered if we could hear more of your journey from undergraduate through working to where you are today.
So I studied psychology at JCU probably about 25 years ago now, so straight from high school. I didn't really know exactly what I wanted to do when I left high school. And I really chose psychology at the beginning because I wasn't too sure exactly what I wanted to do, but I knew so many degrees had an element of psychology in it. I've always been interested in people and learning about people and what makes people tick and things like that. And I guess it was just quite lucky for me that by the time I think end of first year, I really loved psychology and wanted to continue. So did my postgrad dip at JCU as well, where I did it at part-time, so over 2 years, I think it was, while I worked full-time. So after my undergrad degree, I got a job in child protection, and sort of only planned to stay there for 18 months or so, but ended up being there for about 7 years. And in hindsight, it was a challenging job, but it was also a really nice introduction to leadership and working across systems and rapport building really quickly under really tricky circumstances and networking with other sort of government agencies and things like that. And I think that in conjunction with kind of doing my honours year as well, really kind of helped kind of give me that platform to further my career in psychology.
Was child protection sort of where you thought you would go for that long of a time? I guess you said you thought 18 months and then you were there for 7 years. So
Yeah, no, like it was like I knew what child protection vaguely was, but didn't understand it completely when I started. It was really just going to be a job for the time being until I figured out what I wanted to do, until I figured out whether I wanted to do my internship and become registered. Like I really had no idea. But I really enjoyed the leadership. So I worked frontline for probably about 10 years. And then I got into more like the management and leadership avenue. And that's the part I really enjoyed in that area. That's why I stayed for so long, I guess. But I was quite lucky, I guess, in that sense, because I got to interact with a whole bunch of other stakeholders from police and education and health and private psychologists, psychiatrists, even like a whole bunch of people. And I guess kind of being able to be on the periphery of that really made me decide to, go and do my 2-year internship and become a registered psychologist. But I left soon after that into another job.
and so where did you jump into after doing your registration?
Yeah, so my career's actually been quite eclectic, I guess. So I went from working at child protection to working therapeutically with kids who had been removed, so in a similar kind of realm. And I was there for a couple of years, and then I kind of got a little bit, I wouldn't say burnt out, but probably a bit jaded with the world. So then I went across and got a role at a national mental health organisation. So Headspace, I think everyone's aware of Headspace. But in that sense, I worked for Headspace National. So I wasn't working in the centres. but I was working with a small group of people across Australia to launch or develop a service or a program that tried to reduce rates of suicide within high school systems. And that was another sort of eclectic job role, I guess. So there was myself as a psychologist, there was a bunch of teachers and educators there as well. There was some social workers there. So it was sort of a blend, multidisciplinary sort of blend. And that was really interesting, sort of being in like a bit of a melting pot for 5 years or so, really just learning, about education systems and schools and how each sort of discipline can come together to create something that was quite unique in that space. And after we created the project project, we then went and worked in that space to deliver what we created. And it was a really cool sad job because it was, we would travel as a result of a young person ending their life. But in that sense, I got to travel all over Australia. I was really quite honoured to be invited into a number of very remote Indigenous communities, particularly as a non-Indigenous person doing sorry business and things like that, because a lot of those First Nation communities were really worried, and I think still really worried, about young people ending their life and not living to their fullest. So they sort of really invited us in to help in that space. And I think that was a really beautiful, again, sad, but a beautiful space to understand culture and really open my eyes up, to the world of how there's not one right way of doing something. It's so different and so unique, and a big privilege there. So I was there for about 5 years, and I decided I wanted to sort of learn a little bit more and branch out a little bit more. And I had a very random conversation with someone I don't even know, on an airplane once, flying back from somewhere. And we were talking about like trying to figure out what we don't know about the world, and using that, like, being courageous to use that as your next kind of jump forward in your career. And that was about the time that NDIA was rolling out, so National Disability Insurance Agency was rolling out NDIS to the scheme. So I jumped on board, I think at the beginning of that, about 3 months into the rollout of that, because I knew nothing about disability, to be honest. I knew a little bit about intellectual disability and, cognitive assessments, but it was an area I did not understand a lot about. And I don't really know how, but somehow I became the Assistant Director of Queensland to roll that out. It was interesting. But again, looking at that, the biggest social reform we had in my lifetime anyway in Australia, and for all of its clunkiness and all of its difficulty at the beginning, being able to sort of see that from this concept into what it is now, what it's sort of looking at becoming in the future, has been really cool. That job had a lot of travel. So I was on averaging about 10 flights a week. I think I was traveling about 7.5 weeks out of every 8 weeks. So that became a bit much after a couple of years. So then a role came up as the executive director of the Primary Healthcare Network in Northern Queensland. So I was in that role for a little while as well. And again, it was sort of more, I'm not an organizational psychologist, but it was a lot of organizational psych kind of stuff, a lot of emotional intelligence and understanding, how people fit together and how people tick, a lot of sort of developing, I guess, resilient systems within clunky healthcare networks and things like that. And I loved that work, but something was missing. And I knew on reflection, I was like, oh, I think I missed the one-on-one sort of work. I had always maintained a very small private practice on the side. So when I wasn't traveling, I'd see maybe, I don't know, 5 or so clients a week, just to kind of keep that clinical work up. But I was really missing that. So then about 5 years ago, I opened a full-time private practice, and that's where I've been since then. So it's been a bit of a, meandering career, I guess, or eclectic career. But I always find it really fascinating at how sometimes you don't know what you know, and you don't know what you don't know, but sometimes you don't know what you know either. And just being able to sort of go, okay, I know this stuff, but how do I apply that in a different context? And just being, I don't know, having faith that something will work out and give it a go. There's no right decision, but there's no wrong decision. You just try it and see what happens.
Yeah, thank you for sharing that meandering path. You've worked in so many different organizations and spaces, and we could have whole conversations on any one of
All of
those.
that.
But I wanted to pick up on something you just said there of like sort of trusting yourself of going in and being able to apply what you've learned. And I'm trying to think about like, what tips would you have for a student who's saying, okay, I'm about to graduate from my undergraduate degree. I'm sure I've learned something, but how do I feel confident in taking a leap into a new organization or pivoting from one role to the next? What tips do you have?
Yeah, and this is actually a conversation I have quite frequently with I supervise some junior psychologists as well, so some provisional psychs and new grads in other allied health areas. And it's a conversation I have all the time with them. It's kind of like a fine recipe where you don't really know how it's going to turn out, really. So, having a little bit of self-belief, I always say to them, like, being nervous is actually a really good thing because it means you're keen and it means you want to do a good job. And it also means that you're going to have just enough caution to not be arrogant or anything like that. But I guess just to trust that, when anyone goes for a new job, whether you're beginning at your career or, all the way through your career, people don't necessarily employ you for what you bring to the table when you walk through the door on your first day, but they look at the opportunities you have for growth and how you might fit within the team and that excitement of where you want to go in your career and things like that. So I think having a little bit of trust, a little bit of faith, a little bit and self-awareness as well. Reflective practice, I will always bang on about reflective practice. That's so important in this space. But also, I think having that humility that we've all started somewhere, we've all been the new kid on the block, it's okay. I guess that safe to fail attitude as well, that if you stuff up, if you make a mistake, it's okay because it's not going to end your career. It's a learning curve. Sometimes they're little mistakes, sometimes they're massive, but you learn from that and you move forward.
Yeah. And thinking about you going through all these different careers and you've always managed that clinical practice, but now you're also honing in your research skills through a PhD. So I'm curious what brought you back into even more study and getting involved in the PhD.
I remember my very first uni graduation in Townsville, I think it's 2004 or five, I can't really remember. But I remember seeing, I think there were about 4 or 5 PhD students, I guess, getting their award. And I remember thinking, like, that is what I want to do one day. That was the initial kind of sparkle for me. I wanted to do it through JCU because I just had such a good experience with the lecturers and the tutors and, the library staff and the canteen staff and everyone it just feels like home. So even though, there's opportunity, I guess, to do online study wherever I need to do it, I always knew that I'd always want to do it through JCU just because of, I guess, the beginning and end of my career, but having such a good experience in undergrad, I think.
And can you tell us a little bit more about what your PhD is focused on?
Yeah, so my PhD, and again, I guess, it's a bit of a blend of disciplines, looking at psychological birth trauma, so the emotional effect of childbirth and the trauma effect of childbirth, and looking at whether adult attachment styles can help to predict women who might be at high risk or higher chance of experiencing trauma symptoms, and whether increasing attachment security through antenatal care can reduce, that exposure to trauma or the experiences of trauma. Birth trauma, like, rates are increasing. It's such a big area of need. Like, even if we're not all going to become mothers one day, we've all been mothered by somebody, whether that was our own mother or a stepmother, a grandparent, a carer, somebody. And just seeing the rates of trauma increase, I think there's a massive need there to try and understand that better and ideally reduce it if we can.
Yeah, certainly a really important area of work. Are there skills from your undergraduate that you are drawing on and putting into practice now while creating this program of PhD research?
Definitely. There's some things I've learned in undergrad. If I think about, the actual academic skills from undergrad that I learned, there's so many things. Like, I still go back to my third year, I think it was, stats notes, my lecture notes from statistics, and still try and, understand how to do certain things on SPSS 25, 20 years on, whatever it might be. I really, really love, it's like lifespan and development, I think it was psychology across the lifespan, it might have been. I really, really loved that subject. And I shouldn't be surprised, but I am surprised in my PhD work and even in my clinical work, how often I draw on, theorists and things from the textbook. I've still got the textbook in my cupboard, actually, almost on a daily basis from that subject. So that I think has given me that sort of really nice grounding around understanding the whole breadth of human development. And I draw on those things so often. I actually failed my first semester, second year stats subject. And I was one of those high school kids who didn't have to put a lot of work in and got decent grades and never really had to work hard, to get through. And so that was the first thing I ever failed. And I remember at the time it was like the end of the world. And I was going to quit and, whatever. It was a big reaction. And then I actually spoke to my social psychology lecturer, Carrie Ann McBain, and she was beautiful. She had a big conversation with me around it's not failure, it's just another chance of learning and learning something different and, finding another way to get through and finding another way to understand it and being kind to yourself and compassion and all those things I talk about a lot now in my clinical practice, but also in my research. But I keep going back all those times, even now when, elements of my PhD are hard or clunky or, things don't work, my laptop dies, whatever it might be. I keep going back to that conversation as best I remember it with Carrie Ann around this is not failure. This is just a chance to breathe and look at it differently.
And I think that's such a beautiful point to end on, is that we experience hardships and hurdles and even failures, but that doesn't stop us from having a really beautiful career, as you have just illustrated. So Melissa, thank you for joining me on the podcast today.
No, thanks so much for having me. It's been fun.
Thanks for listening to Professionally Psyched. This podcast wouldn't be possible without the ongoing support of our psych community. If you'd like to show your support or if you want us to cover anything on the pod, reach out via our emails, and don't forget you can listen to full episodes on Spotify.